Thank you for staying with us. Before we went on the break, we were speaking with public health physician and health promotion specialist, Dr. Obinna Ibirim, on the outbreak of diphtheria in the country. And some states are said to have a chunk of the numbers that we are seeing. Kano, Yobe, Katsina, Borno, and 15 others said to have the rising number of cases. Now, Dr. Ibirim, before we went on the break, you were talking about people needing to protect themselves. And the question would be that how can people protect themselves? Because there are cases where people have to send their children to schools, and we know schools can be crowded. People go to religious, to churches, mosques, and areas like that. People just move around. How then can they protect themselves and their families?
So I think that it's important to understand how diphtheria spreads, and that would really make sense when we then talk about how to prevent or protect ourselves. So one of the ways diphtheria spreads is through respiratory droplets from people who are infected, right? And also touching surfaces that's where you have these droplets or maybe wounds that are infected, because it's not only about the respiratory tract, it also affects the skin. So there is a skin diphtheria. So then how do you then prevent it? I think we need to remember some of those preventive measures we adopted during the COVID-19, I would say the heat of the COVID-19 pandemic, where we had to wear nose masks. So if you're in an area where there's an ongoing outbreak, face masks can help protect you from inhaling infected droplets. And also we encourage people to cough on a flexed elbow rather than on their palms, or maybe cough into the air, because there are some asymptomatic carriers. So people have diphtheria, but they don't have symptoms, and then they keep spreading diphtheria among others. But then also, I'm happy with what the government is doing. They've set up an emergency center with the primary health care and the Center for Disease Control working together to intensify vaccination, identify areas where you have this outbreak and be able to identify those that are infected and provide them with adequate care. It's also important to say that in addition to diphtheria being preventive, it's also treatable. So there are antibiotics that that can help treat diphtheria. So it's important that if you're having some of those symptoms, please go to the nearest health facility. Don't assume that it's a common cough, it's a common sore throat, right? If you're having symptoms, especially in these areas that have ongoing outbreak, you're having sore throat, you see a swelling in your neck, right? Or maybe you're having some kind of feeling, right, that you are not sure of. This is a time to go to the health facility. And then I also employ health workers to ensure that they are doing adequate diagnosis, and not just this need to be a common sore throat, but ensure you're looking into the throat. And if you see the typical white, grayish matter around the throat, you then report this as a case of diphtheria or a suspected case of diphtheria until adequate investigation is carried out. So if we are all playing our roles, people in the community are doing what they are supposed to, the health worker and the government will be able to contain this outbreak.
Right, and then from the latest statistics that the federal government has released, I think about 80% of the victims so far are said to be those who weren't vaccinated. But what about the 20% vaccinated people, or how would you explain the other people who apparently were vaccinated and yet had it, or am I missing something? And then this talk about vaccine, who is the primary beneficiaries? Is this something that should go beyond the children who are the people most at risk? Can adults take advantage of this window?
So, so first of all, this is statistics, and also you should know that there are some people who are not able to mount. So, so you get vaccinated, right? But the body then there are some people who are not able to get to mount an adequate protection following vaccination. So there's something called vaccine failure in some people, but it's in a minute number of people, right? So, but also, it's also important to say that vaccines protect you from the disease and also severe form of the disease, right? So it's important to put that. So as you can see, whereas you have 7,000 people who are confirmed cases, we have only about 452 deaths, right? If we did not have a vaccination in place, or in those days when there was no Penta or DTP vaccines, more people were dying. So it's important to put this in context to really understand, right, how vaccines work and protect people from the disease or severe forms of those diseases. Now, adults can benefit. So in some places, there is a booster shot that is given to adults. But generally, if an adult has gotten a full dose of Penta vaccine or DTP as a child, is likely protected from diphtheria or severe form of diphtheria. Where we have cases are people who did not get their Penta shot or did not complete their Penta shot in childhood.
Now, at what point does diphtheria get complicated or complex? If you could just break it down for our viewers to understand. Yes, we know there are symptoms, you not being able to breathe appropriately, but how does it get to the point of death?
Okay, so usually when you have diphtheria infection, it affects the nose and throat. So usually there are some symptoms. So people can die from those symptoms, the effect of those symptoms, right? Or the complication, right? So let's start with the symptoms. So there is a typical gray matter that forms at the back of your throat, right? And then there is what we call the lymph nodes that get swollen, really swollen, right? A combination of these or the individual symptoms can lead to a blockage of the airway. And remember, anything that blocks your airway or chokes, right, can lead to death, right? So that is one way that diphtheria causes death. So if it cuts off your air from getting into your lungs, right, you know what that means. So that's one form. The other form is when this now then it's complicated by what we call myocarditis or neuritis that it affects the heart or the nerves, right? And then it leads to dysfunction of the heart. So the heart cannot function properly. And you know what it means? It means that your blood cannot be pumped and returned back to the heart and all that. And that could lead to death. So these are the ways that either the symptom that is associated with diphtheria leads to loss of breath, right, and then death, or maybe when it's complicated with heart or a nerve issue leading to death. And remember, one of the important muscles that the nerve helps works is what you call your diaphragm that helps also in respiration. So if it affects those nerves that controls the diaphragm, that also lead to death. So there are a lot of ways, but this is just for public consumption. What is important is if you're having symptoms at this point, right? You're having sore throat, you're having sneezing, respiratory discharge, right? Or you're observing there is a swelling in your neck that you're not certain about. It's important that you go to the health facility. You might not see the gray matter behind your throat because it requires a doctor to examine and find that. But if you're having these symptoms, please go to a health facility. But before making that decision or while you're on it, make sure that when you're coughing on your flexed elbow, right? And then you're washing your hands. You are also wearing a nose mask to protect yourself and protect your community, because you don't want to now be sneezing if you're infected and putting out a respiratory droplet out there that could lead to infection in others who are not already infected.
Right. So time indeed is of the essence, looking at how sensitive this particular infection or disease is. But in terms of your perspectives as a health worker, so to speak, how much should health workers be concerned in dealing with an emergency as this? And what things would you like to see addressed when we look at the handling of diseases like this in the past, where health workers have been largely at risk and all that, and how susceptible they have been? What would you like to see differently this time around?
So one, it's there should be adequate personal protective equipment for health workers, because health workers are humans. They are also at risk, because then they will come in contact with very sick people. In fact, imagine as a doctor, you're examining a patient who is query infected with diphtheria, and then the person is sneezing and coughing, and not everyone is aware of this hygiene of coughing in the flex able, and you're there talking to him or her. If you don't have access to those protective equipment, then that is you may be inhaling directly the respiratory droplets, right? Or if you're a nurse attending to a wound of someone who has a skin diphtheria, and you don't have gloves because you've run out of stock, right? That could also lead you to getting infected, especially if you have maybe a cut from maybe a previous care you are providing. So I think that the first important thing is that for health workers, the government and even the private sectors who have health facilities should make sure there's adequate PPEs for health workers. The second is also the infection prevention and control training, right? Health workers should be well trained to be able to attend to these infectious diseases and attend to outbreak, right? And it's not just about those who are working in the health facilities, but also community health workers and surveillance officers to be able to identify these cases and carry out the case management, the appropriate case management approach. Also, government also should ensure, and also program managers, nation program managers, to ensure there's adequate supply of vaccines, right? That these vaccines, not just about them being in country, that they are delivered to the last mile. And last mile does not also stop at the health facility. Sometimes you need to ensure you're funding outreaches, because we have a lot of areas in this country, they are hard to reach, they are security compromised, right? They have maybe they are hard terrains or mountainous areas. We need to find a way to reach these people, carry out outreaches, go to them, rather than waiting for them to come, because most times when we wait, they are now inhibited by a lot of access factors, right? So we need to also ensure that the supply system is, our supply side of things are taken care of, to ensure that these vaccines get to people. And then finally, in addition to also making sure that the vaccines are available, we need to also encourage people to come to the vaccines. So it's one thing to get the vaccines to the people, which is supply side, but how do we now make sure that people come and get vaccinated? And that, as I said, is we need to sensitize people using the language that they understand and a mix that resonates well with them, right? It shouldn't just be only radio, TV, social media. We record that there are people in local communities who don't have access to this, right? So how do we reach them through their community and religious leaders? How do we use town criers? How do we use community theater, right, to reach these people, to make sure they really understand that these vaccines are important, to really understand how to prevent and protect themselves from diphtheria, and we understand what the diphtheria is, because people don't understand how deadly a disease is or how important a vaccine is, they will not really take the right decision. So these are the things we need to do, and it requires the effort of everyone. And I want to thank also TVC for also for this opportunity, because you can't imagine how many people you've sensitized through or educated through this program. A lot of people out there who are watching TV might not have heard about this disease called diphtheria, or even know how it's transmitted. So this is also to commend you for using your medium to spread the right information and educate the public on how to protect themselves from diphtheria.
Thank you.
Absolutely. You have hit the nail on the head. And I am wondering if not enough is done. Yes, the government has put in a task force to addressing these issues, but you have mentioned some other areas that need to be included so that we can quickly tackle this or nip this in the bud. But if not much is done, what do you see happening quickly?
So if nothing is done, the disease will keep spreading. So, and what it means is more death, more illness, and more cost to the health system and to the country, the economy of this country. One thing we've learned from COVID is that when the health of a country is affected, every other aspect, the economy, the livelihood, every aspect of the country or these other sectors are affected. So we shouldn't even get to that point. What we need to do is that everyone now needs to come on board. The people, the community, the leaders, the government, the immunization program officer, let's all do our little best to contain this outbreak so we don't get to a point where it then begins to have negative effects on other aspects of the economy, other aspects of our lives. Thank you.
All right. Dr. Obinna Ibirim, public health physician and health promotion specialist, thank you for your time on the program.
It's a pleasure.
Right.